Haddad and Enan Hoque. So welcome. And our clerk will have each of you do an oath or affirmation.
So I'll start left to right. So Mr. Hoque, is it? Did you want to swear an oath or be affirmed?
Be affirmed, please.
So if you just raise your right hand, please. Mr. Hoque, do you solemnly affirm that the evidence you shall give to this committee touching this subject of the present inquiry shall be the truth, the whole truth, and nothing but the truth?
I affirm.
Thank you. So Mr. Haddad?
Affirmation, please.
Affirmation. So if you just raise your right hand, please. Thank you. Do you solemnly affirm that the evidence you shall give to this committee touching the subject of the present inquiry shall be the truth, the whole truth, and nothing but the truth?
I do.
Thank you. And Ms. Deol?
Yep.
Affirmation or oath?
Affirmation.
If you could just raise your right hand, please. Thank you. Ms. Deol, do you solemnly affirm that the evidence you shall give to this committee touching the subject of the present inquiry shall be the truth, the whole truth, and nothing but the truth?
I do.
Thank you. And Ms. Eicher, oath or affirmation?
Affirmation.
So if you could just raise your right hand, please. Thank you. Ms. Eicher, do you solemnly affirm that the evidence you shall give to this committee touching the subject of the present inquiry shall be the truth, the whole truth, and nothing but the truth?
I affirm.
Thank you.
Thank you very much. And I understand you have an opening statement, so please go ahead.
Thank you. I welcome the opportunity to appear again before the Standing Committee on Public Accounts and provide members with further information on the actions the Ministry has taken to improve the oversight of air ambulance and related services in Ontario. In my opening remarks this afternoon, I would like to introduce my colleagues in the Air Ambulance Program Oversight Branch, outline key elements of the provincial government's transfer payment accountability directives, and describe how the branch has aligned its priorities with these directives to enhance the Ministry's oversight of the air ambulance program. I would also like to delineate the oversight and regulatory accountabilities for air ambulance services in Ontario. I'm joined this afternoon by my colleagues Meena Deol, Heidi Eicher, and Stephen Haddad, who are senior program analysts with the branch, and program analyst Enan Hoque. Each member in the branch has taken on the challenge to transform the oversight of the air ambulance program. I am proud to work with a group of individuals who have committed their skills, knowledge, and expertise to develop an enhanced framework for the air ambulance program. This is important and challenging work. As you know, I attended the committee on May 8th, and at that time responded to questions relating to the reports received from Ornge. Since then, I have confirmed that it is the daily reports, not the monthly reports, that are reviewed by my staff members, and I've provided that clarification to the clerk in my letter to Mr. Short dated May 27th. I will provide further details on the work we do with these reports momentarily. I would now like to outline how the branch has developed its oversight role based on the requirements of the amended performance agreement and the accountability framework articulated in provincial transfer payment accountability directives. As defined in the Transfer Payment Accountability Directive, oversight includes the ability to administer a program, assess risk with transfer payment recipients on a regular basis, assess risk and communicate with transfer payment recipients on a regular basis, monitor the results for the services arising from the transfer payments, and taking corrective action where necessary. Staff in the Air Ambulance Program Oversight Branch have a complementary mix of skills and experience in these components of oversight. As per these directives, in order to ensure effective accountability, expectations must be clearly defined. The amended performance agreement outlines the responsibilities and performance expectations of the service provider. Performance must be reported and monitored. Once expectations are clearly defined, effective accountability requires that there be reporting on and monitoring of performance in relation to these expectations. There should be processes in place to report performance, review performance against expectations, and take corrective action as required. The performance agreement outlines a wide range of information that Ornge is required to provide to the Ministry and report to the public. Key to the management of transfer payment programs is the overlay of a risk-based approach. Risk management practices provide the opportunity to establish the optimum level of oversight and control, enabling ministries to provide the proper level of assessment that service delivery objectives are being met. Consistent with this risk-based approach, the branch's initial oversight priorities have been focused on measuring and monitoring patient safety and patient care provided by Ornge. I would like to advise committee members on how we use the reports we receive from Ornge. We have prioritized our analysis on Ornge's resource availability reporting, paramedics, the level of care provided by paramedics, pilot and aircraft availability, and the number of medical transports received and how they are responded to. Daily, we receive resource availability reports that outline the number of requests for medical transports, the number of requests serviced by Ornge, the number of requests that were not serviced by Ornge by reason. For example, the transport was canceled by the sending facility, the transport request was responded to by local EMS, instances where the call could not be responded to due to weather, or due to the unavailability of Ornge staff, be that paramedics or pilots or aircraft. These reports are aggregated into monthly reports. We also received daily resource availability reports for each of Ornge's bases that outline the number of paramedics by shift, the level of care provided, critical care, advanced care, or primary care, the number of pilots by shift, the availability of aircraft by shift, and in instances where these resources were not available, the reason why and the specific duration of the unavailability, and with respect to staffing unavailability, the steps Ornge took to backfill those positions on that day. These reports are rolled up into 10-day reports and monthly reports by Ornge, and we further aggregate this base-specific information into quarterly reports to develop longer-term data for trending analysis. Our immediate focus is the daily reports. We don't wait for a monthly report to take action. In instances where we see patterns, for example, a specific base is not meeting required resource availability levels, one staff member is charged with contacting Ornge to obtain more information, including the steps Ornge is taking to address it. We now have, for the first time, more than 2 fiscal quarters of detailed baseline information on a wide range of performance metrics outlined in the Performance Agreement and Ornge's Quality Improvement Plan. We are augmenting this analysis with ongoing interjurisdictional research on air ambulance programs in Canada and in other jurisdictions. In providing transfer payments, ministries must ensure that the recipients receiving transfer payments have governance structures and accountability processes to properly administer and manage funds and to provide the services for which the transfer payments are made. The Health Audit Services team is presently reviewing Ornge's board governance practices to ensure appropriate processes are in place. Ministries must also have the oversight capacity to ensure that recipients receiving transfer payments are providing the services for which the funds have been received. Through the development of Ornge's 2013-14 zero-based budget, a requirement of the Performance Agreement, we now have for the first time a detailed understanding of how government funding is used by Ornge for each of the services it provides, and we will be tracking this on an ongoing quarterly basis. I would now like to outline for committee members the integrated oversight and regulatory regime that oversees the air ambulance program. The air ambulance program is an integrated system comprised of different components delivered by individuals with specific skills and expertise. These components include the call-taking dispatch system, in which priorities for medical transport are determined and appropriate resources deployed. Patient care provided by certified paramedics performing delegated medical procedures under the direction of transport medicine physicians. Transport provided by aircraft maintained by aviation mechanical engineers flown by certified pilots. Ongoing training of all staff involved in the delivery of the air ambulance program. Quality assurance programs to ensure patient care standards are achieved. And finally, regulatory certification and compliance. The Air Ambulance Program Oversight Branch is responsible for ensuring Ornge meets the terms and conditions of the amended Performance Agreement and the recommendations from the Auditor General directed to both the Ministry and Ornge are implemented. We are supported in this role by staff in the Emergency Health Services Branch, the regulator responsible for ensuring that all ambulance services in Ontario, including Ornge, provide ambulance services according to legislation and established standards. Significant expertise in land and air ambulance services is resident in the Emergency Health Services Branch. This branch is responsible for establishing patient care and transportation standards, certifying ambulance service providers against these standards, conducting unannounced inspections of ambulance service providers to ensure they are meeting these standards, and conducting investigations into incidents and complaints received. Once an investigation is completed, the findings are provided to Ornge by the Air Ambulance Program Oversight Branch for action. Since January 2013, the Air Ambulance Program Oversight Branch, along with Emergency Health Services Branch staff, have met weekly with Ornge officials to follow up with Ornge to ensure the investigation findings have been appropriately addressed. The Air Ambulance Program Oversight Branch also accesses the expertise of several other branches in the Ministry of Health to support our oversight responsibilities, including the Legal Services Branch for advice and interpretation on legal issues, the Health Audit Services Team for audit work and advice, the Supply Chain and Facilities Branch on issues dealing with facilities, the Accounting Policy and Financial Reporting Branch for advice on approval of asset sale requests as required under the performance agreement, and from an information and information technology perspective, the branch engages the expertise of staff in the Health Services Information and Information Technology Cluster. From an aviation regulatory perspective, Transport Canada is the federal regulator. Through a memorandum of agreement between the Ministry of Natural Resources and the Emergency Health Services Branch, we have access to aviation expertise that was utilized to audit Ornge's fixed and rotary wing aircraft operations last year. In addition, the branch accesses consulting expertise as required. For example, we have procured the services of a consulting firm who are presently conducting a review of Ornge's critical care land ambulance program as recommended by the Auditor General. The service provider also has an important role in providing oversight. Medical oversight is provided by Ornge's Medical Advisory Committee, whose membership includes Ornge's 8 medical directors, the chair of Ornge's Quality of Care Board Subcommittee, Dr. Barry McClellan, as well as Dr. Andrew McCallum. The Medical Advisory Committee advises the board and supervises on behalf of the board all aspects of medical care under the purview of Ornge. Their mandate is to ensure that medical practice meets or exceeds the standard of care based on available evidence and medical opinion. I was interested to read the transcripts of the Acting Auditor General's remarks at his May 15th appearance before the Standing Committee on General Government on the role of oversight. Mr. Peel noted for oversight to be effective, there needs to be an assessment of the organization's governance practices. If boards are performing their oversight role effectively, ministry oversight can be tailored accordingly. Through my active participation on 2 of Ornge's board subcommittees, the Operations Committee and the Quality of Care Committee, as a non-voting ministry representative, I have witnessed firsthand the rigorous attention to oversight that the board members on these 2 committees demonstrate with respect to the quality of care and operations. Mr. Peel also noted the importance of periodically obtaining assurance of the reliability of information through audits or site visits to observe operations and service delivery. We will continue to utilize the Health Services Audit Team to ensure that the reports that are being prepared as required under the reports are being prepared as required under the performance agreement. Unannounced inspections conducted by the Emergency Health Services Branch of Ornge's bases across the province further augment our on-site presence. I would also note that the Air Ambulance Program Oversight Branch staff and I have regular daily contact with senior Ornge officials to monitor ongoing initiatives. As I noted earlier, we meet weekly to review Ornge's progress in addressing findings from ministry investigations. We have established formal monthly meetings to review progress against performance agreement objectives and to receive updates on Ornge initiatives. Based on my experience in overseeing transfer payment recipients, colleges, universities, children and youth mental health agencies, children's aid societies, developmental service agencies, women's shelters, and municipal social assistance delivery agents, as well as licensing child care centers and private career colleges, I can assure you that the level of oversight and regulation currently focused on Ornge is significant, as it should be. Air ambulance services are of critical importance to Ontarians, and there have been serious issues at Ornge, as the Auditor General reported, and that this committee has explored in considerable detail over the past year. In closing, in terms of the work that we have done in the Air Ambulance Program Oversight Branch, I think it is helpful to remember where we have come from with Ornge. Under the previous leadership at Ornge, not only was information on a wide range of Ornge's activities not provided to the ministry or the public, some of the information that was provided, for example, the number of transports, was inflated. We now have considerable data that enable us to measure Ornge's performance, and where issues are identified, we follow up with them immediately to determine the corrective action Ornge is taking to address them. Where the ministry previously had limited knowledge of Ornge's service delivery, we now have an almost real-time, detailed information on how effectively Ornge is delivering these services. Where Ornge previously did not publicly report on its services it provided, we have an organization that transparently reports on the service it provides. Has progress been made in enhancing accountability and public transparency at Ornge? Yes, there has been. Is there still work to be done? Yes, there is. This is a process of continuous improvement. One request for medical transport that is not delivered is one too many. I am, however, confident that with new leadership at Ornge and enhanced government oversight, that we are on the right path as we continue to move forward. Thank you, and we would be pleased to answer your questions.
Thank you for the opening statement. We'll go to the NDP first, and you'll have 20 minutes. Ms. Gentlemas.
Thank you very much for your comment, Mr. Jackson, and thank you for coming back. And thanks all of you for being here this afternoon. You open up by basically putting down in words what does accountability looks like when you're at the ministry side trying to hold an agency such as Ornge accountable. You talk about doing the administrative duties, assessment of risk, communication, monitoring a result, and taking corrective action as needed. And you talk to us about some of the tools that you have put into place in order for you to be able to do this. I guess I'll open it up as to, can you give me an example as to, by doing your work of oversight, some of the recommendations, I'd like it as real as possible, that you have done in your communication with Ornge?
I would point to specifically to staffing levels at Ornge. There has been, I would say, historically at Ornge, a shortage of qualified paramedics, an actual shortage of paramedics. One of the things that we monitor with Ornge on a regular basis, and they are required and will be providing us with a staffing plan in June of this year, is that we can, by base, have a full understanding of the number of paramedics they have on staff. Their optimal complement is 232 paramedics. And if I could refer to my notes, I will give you a specific breakdown of that. Of that 232, 154 are full-time and 78 are part-time. As of the end of April of this year, they had 225 paramedics on staff, 155 full-time and 70 part-time. So one more full-time than optimal and 8 less than part-time. We wanted to understand from them what it is that they are doing to address this issue. And in learning that, we know that they are actively recruiting for paramedics, but what we have learned is the time frame that it actually takes to bring paramedics online. The hiring process itself takes between 6 to 7 weeks. They have a collective agreement where the first offer of a position goes to an existing paramedic, and they call from other bases. They still have a contingent of primary care paramedics, which primary care paramedics cannot be matched with either critical care or advanced care to deliver the critical care services that we need. As we have approached them and worked with them to understand this, it takes over a year for a PCP to become an ACP paramedic, And an ACP takes 1 year of practice and then 1 year of training to become to a critical care paramedic. So we do understand how long it takes to fill this pipeline. We use this information in reviewing and accepting a proposal from Ornge earlier this year to add a third team of paramedics to their Thunder Bay base so that their 3 aircraft would be serviced with 3 paramedic teams. That had not been in place before. So by having an understanding of how their processes work and how long that takes, we've been able to review a proposal, accept a proposal, but do understand that it will take time for that organization to get the paramedic care up to, not just they'll be at the right number, but to train their staff to the appropriate level.
Just to reframe that question again, you're identifying a problem and making a recommendation, loosely. If you can give me another example where you've caught a problem from your oversight, you've identified something that's an issue, and what that problem was, and then what you did to what recommendation you made in addition to this. But if you could frame it as that.
Okay.
You noticed this issue, due to your oversight, you caught this problem or this issue,
I'll give you,
and then you made this recommendation.
Yes. Sorry,
No,
I didn't mean to cut you off.
That's
just
it.
saying. I want to talk about a situation that has occurred in Moosonee from March through to early May of this year. There were 2 pilots who left the service of Ornge, and as a result, the rotary wing aircraft in Moosonee was not available to be flown. They did not have pilots for 44 occasions between March 15th and early May. When we started to notice that through the daily reports that base was being downstaffed, we were in contact with Ornge to determine what was going on. That's where we learned that 2 pilots had left their service. We learned from them what their plan was to address this. To serve the communities on the James Bay coast, they were using their fixed-wing aircraft from Timmins as opposed to the helicopter from Moosonee, and then we're transporting those individuals to hospitals in Timmins or Sudbury. What goes on in Moosonee with the helicopter is the helicopter's on Moose Factory. Sorry, the hospital is in Moose Factory. The airport is in Moosonee, and they do river hops back and forth from Moosonee to Moose Factory. We also were paying attention to the number of instances in which a medical transport wasn't taking place during that time period. And we identified over that time period with Ornge and the data that we have from there were 11 transports that were delayed to the previous shift. We followed up with them to determine whether or not there had been any instances where this had impacted patient care. We confirmed with them that they were working with the hospital in Moose Factory to ensure that patients were receiving the appropriate care at the Moose Factory Hospital, and that in those 11 instances over that time period where service was not provided, there was no apparent impact to patient safety. We worked with them to understand when they were bringing those 2 pilots online. They came online on May 16th.
So what were the, there's significant issues that happened in Ornge, and I'll tell you what I think some of the 3 main issues. You've talked a lot about patient care and how you can provide oversight for that. The 2 other issues that were key in terms of the scandal that's before us, one was, I'll just use colorful language, outrageous salaries, as well as public dollars being used for private ventures. In these 2 areas, what are you able to do to provide oversight, to prevent, or to flag these from when they happen, and then to provide recommendations to address them if they do happen?
Okay.
So those 2 areas, salaries and public dollars being used for private ventures.
So with respect to the outrageous salaries that were being paid to many senior officials at Ornge, we have Ornge publicly reports the information of their executive salaries and compensation on their website. That's a requirement of the performance agreement. We have information, detailed information on the salaries that are paid to each of their employees. We receive that information in line by line and in aggregate format. That was part of the work that we had done in developing with Ornge for 13-14 a zero-based budget, so that we know every dollar of taxpayers' money that is going into Ornge, what it is budgeted against, and the services that are being provided for those. That budget was put in place. We'll be monitoring that quarterly throughout the year to ensure that taxpayers' monies are being used for the delivery of services at Ornge. In terms of the public dollars being siphoned off into private operations, there are, as you well know, of this complex web of companies that were set up under the previous regime. That is being wound up by Ornge in an orderly basis. We receive information on that process from them on a regular basis. There are still companies that were incorporated as for-profit companies, particularly on the aviation side, where their aviation assets are held. But we know that those are being utilized, although the corporate structure of those are on a for-profit basis. Ornge is not working on a for-profit model, nor do they have any activities outside of Ontario.
Okay.
I hope I addressed.
Just a small clarification. When you said that you now have details on every salaries that is paid to everybody that work at Ornge, does that include the medical, I forgot their title, medical director, or basically the physician that sits there at Ornge and that helps direct care during transfer? Does that include them? Are they captured in that?
So the position you're talking about is transport medicine physician. I can't tell you, Ms. Jelinek, definitively sitting here if we have that information for those positions. I believe that we do. I don't have that information with me to confirm that categorically for you.
Okay.
But we do know how much they spend on transport medical physicians as a total. That would be one of the line items that we're getting in our zero-based budgeting work.
Okay, so you went to a zero-based budget for them?
Yes, we can have for Ornge, we know how much they literally spend on everything they do at each specific base. I could tell you how much they spend on fuel at this base, how much they spend on medical supplies, salaries, benefits, training, legal fees, on and on and on.
Sorry. Go ahead. Okay. I want to talk about the governance a little bit. In your opening comments, you made mention that you now sit on 2 committees of the board, and I forgot which one they were. Could you remind me?
The Operations Committee and the Quality of Care Committee.
Okay. And how did that decision came to be? Were you invited?
Under, I believe it's Article 8 of the Performance Agreement, when it talks about the Quality of Care Committee that Ornge is to strike, it is specifically indicated that there would be a ministry representative on that committee, and I was appointed in my role, I was appointed from the ministry perspective to be in that role. There is no specific reference in the Performance Agreement to the Operations Committee, but I was invited by Ornge to be a participant in that committee, and my membership in the ministry representative is reflected in the terms of reference for that particular committee.
And does the ministry, through your office, has any contact with the board? As in, how do you know that the board is doing a good job of governance?
So in terms of the contact we have with the board, as I did note, my contact is on 2 board subcommittees, of which with the members of the board members on those committees are all the members of Ornge's board, with the exception of 2. The chair does not sit on those committees, and Mr. Harnick does not sit on either of those 2 committees. In terms of our contact with the board, I don't have direct contact with the board chair, but I interact with those board members on those committees. We have, as part of our due diligence, have had the Health Audit Services team in Ornge reviewing their board governance practices to provide them with the best advice that we can, that they are actually following appropriate processes. And actually this coming Monday and Tuesday, I will be attending a 2-day strategic planning workshop that Ornge is hosting with members of their board, senior management, other key stakeholders, to provide advice to Ornge on their ongoing development of their 5-year strategic plan. So that's my interface with the board. I know that senior officials above me in the organization would have contact with Mr. Delaney on a fairly regular basis, the board chair.
They would have contact with Minister who?
With Mr. Delaney.
With Mr. Delaney.
With the
Okay.
board chair.
All right. So do you feel confident that with the structure you have now, where you are invited to participate in strategic planning workshop, you are within the terms of reference of the committees of the board, ministry staff, do you feel confident that if the board was to fail in their duties of oversight, that would allow you to catch this?
I think it would certainly give me strong insights into that. And I don't sit on, or do we participate on the other 3 or 4 different subcommittees of the board, but I can, from my own experience, see that there is a rigorous governance structure. There's clear terms and reference in outlining the requirements and responsibilities of that board committee. The quality of information that comes to the board that is provided by senior management at Ornge appears to be quite sufficient. And the board members themselves are actively engaged and questioning, probing, and providing direction as you would expect a high-performing board to do.
Do you ever review their minutes?
We do not receive copies of the board minutes.
If you were to request the board minutes, do you figure you would get them?
They would be provided to us. We've not requested those. The performance agreement enables us to request just about anything that we would want to request beyond what is articulated in that. The one area where we do receive extracts of board minutes is with respect to the sale of assets, that proposals that come to the minister. They have to be authorized by the board, and we would see those particular minutes.
And you described that the board has a rigorous structure, they have clear requirement. How do you know that?
I know it from witnessing it, participating in the meetings, receiving the meeting packages. One of the things over the years that I've worked in transfer payment accountability fields, I think one of the key things that I've heard from other board members I've spoken with is the importance of actually getting good information well before the meeting so that you actually have the time to analyze it and think about it, so it's not just plunked down in front of you before you start. Mm-hmm. So that seems to be a practice. And the board members of Ornge that I interact with have quite significant experience on boards of other organizations.
Okay, because I mean, we had the opportunity to question basically every member of the board that got fired in January 2012, late December 2011, and they were all extremely knowledgeable, qualified, lots of experienced people who did not provide any quality oversight of Ornge. So I can see that you have high regards for the people on the boards. You feel that the structure is solid and the requirements are solid. Do you see anything else that could be done to make sure it doesn't happen again? And I'm talking specifically poor oversight from board to the executive side of the company, of the agency, sorry.
It is something that I have thought about over time, and as I said, I get a line of sight into, the ministry gets a line of sight into two of the subcommittees. It may be, I think there would be some value in extending that line of sight across the other board subcommittees. It's not something that we put forward or propose, but if you were to ask me where I think we might be able to have a more detailed understanding and actually see it and witness it and be more ingrained in the board governance.
Are the minutes of the boards, usually minutes of the boards of transfer payment agencies of the Ministry of Health, whether we look at the mental health agency, community health centers, the hospitals, their minutes of the board meetings are all public documents. Their board meetings are public meetings. Does this apply to Ornge?
At this point, I don't believe, well, I not believe, they do not make their board minutes public. And in terms of, are those open public meetings, I do not know that answer.
And you are out of time for your first allotment
Right.
anyway.
But I very much appreciate that, I'll call it advice.
No problem.
So we'll move to the government. Ms. Jacek.
Thank you, Chair, and thank you, Mr. Jackson, for coming back with your team. And just to start off, since you do have the whole team here, first of all, certainly on the government side, I want to assure you that we value our public servants here in Ontario and know that you do good work on our behalf. But Mr. Jackson, perhaps you could outline a little bit what each of your team members is responsible for, and if you'd like to tell us a little bit about their qualifications for the position, that would be very helpful as well.
If you're okay with this, I would actually like the staff themselves to provide that information as opposed to hearing it in my voice.
Yes.
So maybe we could start with Heidi.
They were also.
Okay, so my name is Heidi Eicher. I've been with the Ontario Public Service for 26 years. I have worked in a number of capacities that have involved an oversight function, and I have worked with many transfer payment recipients in an oversight and advisory capacity. I've also worked for Management Board of Government as a senior advisor on a number of financial files. Academically, I have a master's in public administration from Carleton University, an undergraduate degree in political science. I have a change leadership certificate from Humber College, and I have extensive Six Sigma skills and training. Most recently, I was working before I came to the oversight branch here, just to give you an example, I was working with the Ministry of Training, Colleges and Universities in the public, I was working in the accountability branch in the universities unit, and I had oversight responsibility for transfer payments to medical schools, and in particular compliance against the medical plan and ensuring that they were delivering against a provincially approved medical plan.
And your area of responsibility within the oversight branch now?
My area of responsibility has focused primarily on asset sales at this point, and developing and working with Ornge on the asset protocol and the sales with respect to the SK-76 aircraft. I've also been involved in reviewing and doing the analysis on staffing that Mr. Jackson was referring to previously, and taking a look at the Moosonee situation and working that through with Ornge. So those have been my key areas. In addition, I've I've been responsible for different various pieces of correspondence, briefing materials and such.
Thank you. Ms. Deol?
Hello. Okay. Yeah. So my name is Meena Deol. Prior to this position, I was a regional emergency manager with the Ministry of Community and Social Services and the Ministry of Children and Youth Services. There, I was responsible for preparing and implementing contingency planning. As well, I was involved in some larger events, I would say, and providing leadership and direction throughout those. For example, as part of the Haiti repatriation in Central West Region, I was also a regional emergency manager. I participated in that. I've also been the lead in planning for distribution of over.
Could I ask you to just slow down a bit? Some of the
Oh, I'm
committee
sorry.
members
We
are
want to
having,
catch every
Okay.
word.
are having difficulty just following you.
Oh, sorry. Okay, so I've also trained at the Provincial Emergency Operations Center. So a lot of what I did as an emergency manager was planning, project management, and implementing plans. I was also the Freedom of Information Coordinator for the Toronto Regional Office with the Ministry of Community and Social Services, where I severed and released documents, as well as provided advice on the Act. Prior to that, I have transfer payment experience as well. I was a program specialist where I did monitoring and TP accountability for transfer payment agencies, including service contracts with municipalities and developmental service agencies. And that was for the entire transfer payment budget cycle, starting from budget submission to year-end reporting, quarterly reporting, and monitoring of any variances in regards to service or financial data. I also trained transfer payment agencies on the service contracts. Also in that role, I was also the lead for incident reporting from transfer payment agencies as well. Many agencies have to report daily on any incidents that may occur, and I would follow up on those. Prior to that, I was a special agreements officer. In that role, I basically made decisions for reviewing medical and financial information to see if families were eligible for income assistance programs, as well as had a budget. And within that budget, I provided assistance to families caring with either adults or children with severe disabilities, and managed that budget, provided funding, and made decisions on allocations regarding respite funding. My role here, speaking too fast. Yeah. My role here is primarily I've been the lead for the follow-up on investigation files. I've also been the lead with the emergency management branch with the Ministry of Health in regards to any incidents that may be occurring, and staying basically on top of some issues. For example, there was the James Bay flooding, and working with Ornge and participating in those teleconferences and meetings. As well as Heidi, we prepare correspondence and briefing materials as well.
I just had a quick clarification. You said when you were responsible for the budget cycle for transfer payments, was that across government?
No, that was with the Ministry of Community and Social Services.
Okay,
I focused mainly on municipal service contracts and developmental service agency contracts.
Okay.
Please go ahead.
Thank you. My name is Stephen Haddad. Prior to joining the Air Ambulance Program Oversight Branch, I worked with the Assistive Devices Program Modernization Unit. The committee may recall that the ADP was called to testify before this committee in October 2010, I believe, and there was a follow-up Auditor General's report in 2011 on the review of that work. Some of my particular contributions as part of that were developing operational policies and procedures as part of the program review and modernization. Some of the specific files that I worked on included reviewing pricing for communications and visual aids, doing procurement of technical expertise, for example, reviewing proposals for a central equipment pool for high technology wheelchairs, as well as selecting a vendor to create the new IT system, ADAM. Unfortunately, I don't remember what the acronym stands for. In addition to that, I more recently have been involved with the Critical Care Land Ambulance Program Review, which was one of the Auditor General's recommendations in his 2012 report. In terms of previous experience with adjudication of funding programs and managing relationships with transfer payment recipients, I have direct adjudication experience with the primarily with the Economic Development Cluster, so the International Strategic Opportunities Program, as well as contract management with grant recipients under programs such as the Next Generation of Jobs Fund, Eastern Ontario Development Fund, Communities in Transition Program, and Advanced Manufacturing Investment Strategy. Over my time with the OPS, I have also been actively involved in what I would term implementing government decisions. So, for example, drafting of Treasury Board and Cabinet submissions, and implementing recommendations of third-party reviews, such as Auditor General reports. In terms of what my specific workload is right now, since I've joined the branch, I'd say it's been fairly wide-reaching because of the nature of the file. As I previously mentioned, one of my big focuses right now is on the work that we're doing toward reviewing the Critical Care Land Ambulance Program, both for value for money and service delivery. I also was responsible for drafting the Sale of Assets Protocol, which Ornge is required to follow under Article 16.4 of the amended Performance Agreement, to seek ministry approval before selling assets with a residual value of over $100,000. Attending meetings, as my colleagues have mentioned, we attend frequent meetings with Ornge senior management to be apprised of the initiatives that they're working on. For example, a readiness initiative, which I believe Mr. Jackson mentioned in his opening remarks, and interfacing with other divisions of the ministry on issues that may address or impact the delivery of air ambulance services. For example, a proposed life or limb strategy.
Thank you. Mr.
Hi, my name is Enan Hoque, and I have a Bachelor of Business Administration with a double major in Finance and Strategic Management from the Schulich School of Business, York University. Prior to joining Ontario Public Service, I ran and operated my own IT web consulting company, where we developed websites, graphics, and brochures for small businesses such as restaurants. This is a skill that I taught myself, and I really enjoyed it. But I decided to move my career towards the government side, and I joined the Ontario Public Service in 2010 through the Ontario Internship Program, which takes over, on my year it was over 5,000 applicants, but I heard they take even more and select a smaller amount. Since starting there, I've had the opportunity to work in business and financial planning roles for 5 different ministries, the first one being Community and Social Services, where I assisted the finance manager in reviewing the quarterly reports and other finance-related material for social service and children and youth agencies of Ontario. And moving from there, I went to tourism, Ministry of Tourism, Culture and Sport, where I worked with the manager there, again in another finance capacity, where the major tourism and culture, at that time it was just tourism and culture, the agencies there would submit their reports, variance analysis, and we would identify anything that needed to be identified for the manager for further discussion and review. Moving from there, I left the Ontario Internship Stream, which is the goal of the Ontario Internship Stream is to translate those skills into a full-time or contract work in the government. And I landed my first position with the Ministry of Community Safety and Correctional Services, and in that role I had specialties in contract management, so multi-million-dollar procurement contracts that finished for Ontario's major correctional institutions, such as, for example, their new jails, and where I had to understand the contracts, had to ensure that the vendor on the other end is meeting their contract obligation, whether it be the reporting requirements, whether it be that the prices were met as appropriate, and if there were changes or amendments required, that the due process was followed for full transparency and accountability. And from that role, I moved to the Ministry of Attorney General, where I worked on it's a bit more on the back-end controllership, where it was it's the administration and finance of salaries and wages and expenses to support the lawyers of Ontario. And finally landing to where I am here today in the Ministry of Health and Long-Term Care for the Oversight Branch. in this role, I try to utilize the finance, data analysis, and project management skills that I have. Particular to the work, as Richard noted in his opening remarks, our focus has been on the availability of resources for Ornge, in addition to their staffing. And one example of what I've been doing is that I've been gathering the resource availability reports, which can have multiple sheets within a workbook, but putting that together in a way where we can now baseline quarterly data and understand quarter to quarter what is increasing, what is declining, what could be the factors behind it, what is Ornge planning to do over their next year, and going forward, and any statistical and data analysis type of work. The meeting I had last Friday was a kickoff of a resource and statistics working group I have with Ornge, and this is to complement the work the health audit team is doing. And what we're doing there is beginning to review the reports to see how it aligns with the performance agreement and improving on it where possible. Again, based on the findings of the health audit team, it'll greatly influence the way the working group and what we'll work on.
Thank you. Well, it certainly looks like you have a good team, Mr. Jackson, in terms of the range of qualifications and experience that you have just demonstrated. Obviously, we're here to respond and ensure that improvements are occurring, very much guided by the Auditor General's special report of 2012. And the first recommendation was very much related to the cost of ambulance services, and was Ontario comparable to other jurisdictions and so on. So perhaps could you just outline to us your progress in that regard? We've heard about a lot of pieces of this, but are you rolling this up into an analysis of the various types of transport? Does relate a little bit to the critical land ambulance piece as well, I suppose, and what progress you're making in terms of looking at those costs and ensuring we're getting value for money?
Yes, I'd be pleased to outline the work that we've been doing on this. We have conducted a survey of other air ambulance providers across the country to have an understanding of the range of services that they provide and how much they're investing in that particular program, as well as how many transports do they do, that type of work. One of the things, I think significant observations we have from this is actually the challenge of doing detailed apple-to-apple comparisons. I never use the word apple to oranges comparisons, but because what we have here in Ontario, delivered by Ornge, is really the full suite of services. From they train their paramedics, they run the dispatch center, they own their own aircraft, they use special agreement carriers, they have a critical care land ambulance program, which is not common in other jurisdictions, as well as they do organ transplant recovery flights. And when we've looked at other Canadian jurisdictions, those specific functions tend to be hived off between various parties. It would be, you'll have a province that the province does the dispatch. They rely on a series of service contractors to provide the actual service. The training is done, the paramedics themselves find themselves being trained. So what we're trying to do is go beyond a simple algorithm of there were 18,000 transports in Ontario and that cost $152 million, because there's much more beyond that. We've also, there's a branch in our ministry that has the responsibility in, where they do literature reviews outside of, like literature, and we've posed that question, so can you provide us with literature reviews that have been done on the provision of ambulance services and what those costs are? So we've got a a good pool of information together at this point. We now need to synthesize that and come up with some specific conclusions. But it's not as simple as it might sound.
I'll save my 2 minutes. Thank you.
Very well. So we'll move to the opposition. Mr. Klees.
Thank you, Chair. Mr. Jackson, you indicated in your opening statement that you got back to the clerk to clarify that it was the daily, not the monthly reports that your staff reviews. When did you determine that?
I determined that shortly after my appearance here on May the 8th. I'm sorry,
So up until that point, you weren't even aware whether your staff was reviewing either daily or monthly reports?
I was aware that they were reviewing daily reports, and I did not answer that question correctly when you posed that to me.
Well, there's quite a difference between reviewing a monthly report or a daily report. And should it concern us that as the manager of the oversight branch that you didn't know something as fundamental as that?
We roll up daily reports into longer time frames. I apologize for not providing the correct answer, Mr. Klees.
Can you tell us who amongst your staff or from the staff that is here is responsible for which reports?
In terms of who is responsible for which reports, I would start off, generally we take a team approach to this, but if I was to specifically talk about reports in terms of the daily availability report and the monthly availability reports, the number of calls serviced, the number of calls, those reports are done.
Let's take it a report at a time.
Okay.
We've got some time this afternoon, which is why I wanted you to be here. I'd like to get a handle on exactly who is doing what and how they're doing it. So I don't care which order you want to take the reports in, but we have some copies here. I'd like to be able to identify the report and the staff member who's responsible for specifically reviewing that report.
Okay. Okay, I will start with going down the reports in Schedule A. Do committee members have a copy of that page from the performance agreement?
We do. So if you could tell us which report you want to start with.
So in terms of the report that starts, number of complaints, 3B, 4A, 4B, 4C, 4D, all with respect to investigations reports, investigations, a number of open investigations. Those are compiled in one report referred to as the Inspections and Complaints Report.
Okay.
Meena Deol, as her role in her role...
Sorry. You have to bear with me because this is the first time I'm seeing these reports, so I want to... I believe you gave us copies of these. And so specifically, which report is it that information is rolled up into?
It is a document. It is called Investigations and Complaints.
Okay, I have it here.
There is a line graph and tables underneath that.
And who is responsible for receiving that report and analyzing it?
In terms of the work that we do with this report on investigations, Meena Deol is the lead on investigations follow-up.
Okay. The way I'd like to deal with this is just systematically go through this. So if I could address then the next question to Ms. Deol. Okay. Do you have a copy of that report in front of you?
I do.
Okay. I'm looking at the March 1st, 2012 to March 31st, 2013
Correct.
report headed Schedule A. So if we're looking at this report, could you describe for me when you received this report, or let me ask you first of all, is this the form that you get the report in as we see it here?
That's correct.
And who do you get that report from?
It's posted in the SharePoint site. We have a shared site that we use with Ornge for posting of documents.
So Ornge posts this information?
Correct.
Okay. And do you get that electronically?
It's electronic.
And when do you get this?
It should be posted at the end of the month, and that is on the site.
So this is a monthly report?
It's supposed to be a monthly report. This is one of the reports that I've been currently working on, and it's being revised. It's also a report that we've had our audit team look at as well, just to understand that Ornge is following, to understanding of the process Ornge is using to complete this report.
Okay, now you did say it's supposed to be monthly.
It is monthly, actually. I don't track the reports. That's actually one of my colleagues who tracks the reports and ensure that they come in every month.
And so who tracks them?
It'd be me.
Okay. And do they come in regularly?
So I do keep track every month, every schedule, and based on my schedule, the first one came in June 2012 and has since come in on time every month,
Okay.
as per the SharePoint and performance agreement.
So back to the report then. When you receive this and you look at this report, can you tell me what it is that you're looking for by way of analyzing this information? What is the first thing that you look for here on this report?
The first thing that should be on this report, as I said, this report is currently under revision, is that it could clearly define the number of complaints that have been received. And it also should outline the number of investigations, the number that have been completed, and the number that are open.
Okay, so if you would walk me through this report, what is your thought process as you go through this?
Through this process of looking at this report?
Yeah.
This process, like I said, this report is being revised.
I don't care if it's being revised.
Yeah, that's fine.
This is what we're looking at now.
Okay.
So we're looking at this report. What is it that you see on this report?
Right now, on this report, it notes that there's Ornge investigations. It notes, and then there's a number that have been opened in March 2012.
And how many have been opened? How many investigations have been opened in March?
From this report?
Of this year.
On this year?
Yes.
The 2012-2013 is the fiscal year, and it notes 378 investigations. However, there is a definition here, and that's the number of files Ornge has opened internally.
No. My question is, how many investigations, according to this report, were opened in March of this year?
This is the report. Sorry, I'm looking at the wrong report. I'm looking at the January report.
The report we're looking at states at the top, March 1, 2012 to March 31st, 2013.
Okay. This one says 40.
Okay. And then what is the next line under the 40?
The number of investigations the ministry has opened, and it notes in March there's 4.
Okay. And then the next line tells us what?
The total number of investigations, which is 44.
Okay. And the next line?
The number of investigations that have closed, 9.
Okay. Next?
The total number of investigations which are open.
Okay.
The next, sorry?
Go ahead.
The next line outlines the number of external complaints received.
Okay.
The next line outlines the external number of complaints closed.
Okay. So you have that raw material, that raw information that has now come into you.
That's right.
What do you do with that information, and how do you analyze it in terms of the impact on the service level that's being delivered and the implication to patients? What is your next step?
My next step is to look at the reports to see if there was any data integrity issues with this report. The way I would do that,
how would you determine that?
Well, the first thing that I did notice, looking at this report, is that on April 8th is when I looked at this report. I called Ornge and I said I think that there's an issue with this report in regards to the number investigations, the ministry investigation files noted on this report. It's different than what I had. I asked them to look at the number of investigations that they had opened. We spent the next few weeks reviewing each investigation file that was open with the ministry to ensure that each one was from their end and our end either opened or closed and documented correctly. I asked Ornge to make those corrections. The next thing that I did is that also to give you a better understanding of this report, daily we receive incident reports from Ornge that are forwarded not only to APOB but also to our investigation services unit who have access to their reporting system. Each one of these instances or incidents is noted into their database, which our investigation unit has access to. Further to that, when I saw that there were some issues with this report, we also engaged our audit team as well to review the processes in which Ornge is documenting this information to ensure that we're getting accurate information.
So based on this report,
yes,
is there any concern or was anything flagged in terms of implications to patient care?
In regards to patient care, what I'm concerned with this report is the number of investigations that are open. And I also followed up with Ornge in regards to that as to why there are a total number of files that have been opened and why they're still open.
And how did they respond to it?
They actually have they have a system where they prioritize the type of calls, the type of investigations, and closing those. And they prioritize calls that their investigations that may have had an impact to patient care. Also to note that each one of these incidents where they're each one of these cases where there may be implications to patient care, we are notified daily. So I'm not waiting for a monthly report. We're not waiting for a monthly report to be notified of that. That report is sent to our investigations unit, who has the responsibility to conduct investigations. They'll review their incident reports daily to see if that there is, under their responsibilities, if they will be conducting an investigation into that matter.
So during this month, how many cases were there where there was an implication to patient care?
As I said, these files have now, that would be determined through investigations process. That would be led by the investigations unit with Emergency Health Services branch.
So you don't have that or wouldn't have that information?
No, the investigation services is responsible for conducting the investigation. What they would do is they would review the incident reports if they were conducting an investigation to see if there were any contraventions to the Act or standards. They would then provide our branch with a copy of their findings. Once they had completed the investigation, we would then forward any of the findings to Ornge and then request corrective action on those findings.
Do you at any time seek advice from others in the Emergency Health Services branch who have been responsible for ambulance oversight in the past?
I do.
And who do you speak to?
I speak to the Manager of Policy and Implementation.
And who is that?
Rob Nishman.
Okay. Anyone else?
The Investigation Services, yes.
And who is that?
Rick Brady.
Okay. And how often would you speak with them?
At least weekly. I speak with, when I started with the branch, the first thing that we did was the priority was to look at open investigations and to ensure that we're acting upon those. And so the first thing that we did was establish weekly meetings with Ornge and myself and with EHSB to review open investigations to ensure that there's follow-up.
Okay, thank you very much. Mr. Jackson, what is the next report?
So the next series of reports starts with, and I'm going to talk about two reports that we do not yet have is reaction response times, scene calls, 5A, and 5B, interfacility calls. Ornge's current computer-aided dispatch system does not systematically track that information. So we do not have information on a systematic basis on the time frame from when the call is placed to when the call is responded to. That is an issue with the dispatch system that had been created, and it was not tracking that time from the time the call was received. It was tracking the time from when the resource was actually identified to be deployed. So we don't have that spectrum. Ornge has, and this was flagged by the Auditor General in his report, Ornge has procured a new computer-aided dispatch system that will enable that information to be captured and reported. That dispatch system is scheduled for implementation in fall of 2013. One of the 13-14 quality improvement plan metrics that Ornge has established is time from call received to time when wheels are up. And that will be captured and reported in that system and reported to the ministry, and we'll be able to track that. So we do not have those two reports.
That's relatively important information, isn't it, in terms of
I would,
that you're in, right?
I would agree with you. I think it's at the core, one of the cores of what Ornge and ambulance services should be doing is the time it takes from T0 to the time that you've delivered the service.
So the fact that it was identified in the Auditor General's report, would it not have made some sense if the computer system isn't capable of tracking that at least an effort be made to manually track that until we've got the technology in place?
Ornge is tracking that manually. They can from their phone systems. They have tags from when those calls are being done. In terms of, so they're measuring the time it takes, and they've disaggregated this by two categories. For an on-scene call, where they want to be able to confirm within 10 minutes of the receipt of the call that they are deploying that resource. In their 12-13 quality improvement plan, they wanted to meet that, I believe it was at 100%. Their manual measurement of this in March, I believe, is in the range of 90% of on-scene calls are responded to but confirmed that they will be responding within 10 minutes.
So Mr. Jackson, here's my concern, and forgive me, but it does cause me some consternation when I hear you say, I believe this is what's happening. I believe these are the numbers. And what you're telling me, they're doing it manually, but obviously they're not reporting it to you. And my question to you is, why are we talking in possible numbers when your responsibility is oversight, and the track record has been one of a lack of reporting and a lack of ministry oversight? Help me to understand and give me some comfort here.
Half of your time.
I would, a poor choice of words on my half, believe. Believe was, I didn't want to quote a specific number without referencing it, but if you would allow me, I will refer to and I will give you the actual number. In Q3, it was 90% of the time for an on-scene call that they indicated within 10 minutes that they had a resource available to be deployed. In Q3, for the interfacility calls, so the target that they set in the quality improvement plan was for an interfacility call that within 20 minutes of the receipt of that call, they would indicative of resource was available within 95% of the time. In Q3, they achieved 96% against that particular target.
Okay, thank you.
Thank you. We'll move to the NDP. Mr. Ellis.
Thank you. I'm also interested in looking at oversight, and I don't know if you can answer this, but if you can, please do. How would you say that oversight at your ministry has changed since everything that has happened and became known?
Oh, sorry. In terms of how oversight has changed, the first point I would come to is there was not a dedicated branch or unit responsible for oversight of the air ambulance program. There were people that did that as parts of their job, but not fully dedicated to it. In terms of what else has changed is the considerable amount of information that we now have about Ornge's performance. I don't believe that if I had been sitting here 18 months ago that I could be relaying information to the committee with respect to, at this particular base, over this time period, 98.9% of the time was staffed with 2 paramedics. So we have that line of sight into Ornge that we didn't have. We've also, I think one of the fundamental changes is a change at, I wouldn't say at the ministry, but it's actually a change at Ornge, where this information is provided to us. Whether we ask for it, they provide it to us. It's done in a transparent way. It's not about hiding information. It's about providing information. Are all these results positive in terms of the service that Ornge is delivering against particular parameters? It isn't. So if I was to summarize it, a dedicated group of people looking at it, specific requirements of Ornge to provide that information, and the fact that we're actually receiving that information and analyzing that information and getting back to them when we see issues that we think need to be addressed.
In all the things that we've done that you've outlined in terms of oversight, why couldn't have any of this been done? What prohibited this from being done before? Why couldn't the ministry have set up an oversight branch the way you've outlined and done this different, taken the various steps that you've outlined? What prohibited or precluded the government from doing that before, if anything?
I don't think anything would have prohibited
I would tend to
the
agree
ministry from doing that.
Sure, thank you. Moving forward, there's a number of issues that we've outlined and we've addressed here at Ornge. What have you learned from your experience in terms of providing oversight for Ornge that could apply to oversight in perhaps other ministries that could assist in preventing future Ornges from occurring?
In terms of what I think is a couple of important lessons learned from this experience. And I think you need, I would suggest that you need to tailor the amount of oversight you have to the perceived risk of that organization or that service may present itself to. But when I look at, and I'll give you my own experience of regulating private career colleges. What did we know as a ministry at that point in time about private career colleges? We knew where they were. We knew how many people there were. We had some basic financial information about them. But we didn't have that day-to-day intelligence about what was actually going on at the 600 private career colleges in Ontario. And then all of a sudden someone would go bankrupt and students would be put out on the street. So I think if I was to say one of the lessons learned is actually having this type of information available to you so that you can see things that are happening with not overly embellishing this, but literally in real time. I think that is key. I think what is also key is an ongoing dialogue with the service provider and having the candid conversations that need to take place. I would, in my role as a regional director, Ministry of Community and Social Services would have a group of program supervisors that would interact with the respective transfer payment agencies. That might be done periodically. They might have a full, several different agencies they were responsible for, but they didn't necessarily have that day-to-day understanding of what was going on and that regular contact. But you need to balance that against risk.
Sure. Thank you very much. My colleague has some more questions.
Yeah. So I'd like to pick up on this ongoing dialogue that you talk about. Kind of what has changed, because if you read the newspaper every now and again, you will have known that Ornge in January 2011 wrote an extensive letter outlining exactly the web of for-profit company that they were to set up. They CC'd the world on this letter. They came to Queen's Park, they came to the ministry, they briefed them, and not a peep came out of anybody. What has changed with your branch that now, if something like this was to be presented to you now, you figure you would react?
I can tell you with 100 degrees of certainty that I would react, and the people that I work with here would react to that. Why there was not a reaction to that in January of 2011 is something I do not know. I do not understand why it has. I've certainly followed the testimony before this committee over the last, since it started last March. I can't explain what happened when I wasn't here and being involved in that. But in terms of things that I think have changed is, and I'll give you an example here. I want to give you a good example. Give me a moment to think of one, recall one. When we would see, I'll genericize this. So we get a daily report from Ornge that says these were the number of transports we did, these were the number of transports that we didn't do, and these are the reasons why we didn't. And if we see an incident where it says we did not transport someone because there was a shortage of an air vehicle, we're immediately on the phone. What do you mean by that? What was the shortage? Why was the shortage? What happened with that patient? How was that patient transported? Now, Ornge is telling us that information. We're reacting to that information. I don't think in the past we would have, that I will call that the old Ornge would have even have thought that that was something that they would report to the ministry, or something that the ministry was not tracking or monitoring.
So I guess my question remains as to what has changed. How come presented with the same information by the same people in the same format, you would react, but the people before you didn't? Is it? What has changed?
What has changed? And what has changed is that there's a specific group of people who are dedicated and responsible for paying attention to that and acting on that, and that is their sole purpose, as opposed to a situation where I would characterize it perhaps that Ornge was one of a series of ambulance providers. It happens to be the air ambulance provider, but there's upper tier municipalities who all are involved in this action, and that people, for whatever reason, did not react to that. I don't know why they didn't react to that. It certainly concerns me. I would imagine that it concerns many people.
So when you try to answer those questions, you say because your sole purpose is to oversee, then you take it as your responsibility to do so. There are many, many transfer payment agencies at the Ministry of Health, like thousands of them literally, that do not have a sole purpose branch or unit within the ministry that is there to oversee. I'm fully confident that everything that goes on at Ornge right now is looked at, is analyzed, is questioned, is worked upon. But I'm worried that there's other little oranges out there.
I think I would say that there's an element of a risk analysis that whatever the oversight body or whatever the branch is or whoever it is that is responsible needs to have confidence in the capacity of the governance of that particular organization and how that is achieved in other areas of the Ministry of Health. Ms. Gentleman, I do not know how that is done. But I can tell you, I mean, and I think Ornge has been obviously a hugely significant issue for the province and what has transpired at Ornge. And as a result of that, in the high level of risk, there has been dedicated resources assigned to it. Are there other Oranges out there? I do not know that. That's not been the focus of my work.
No, none of that. None of us know that. But by your answer, I mean, you give us confidence that strong elements of oversight are now there. You guys are part of this. Your job is to oversee. You know how to do your job. You're dedicated to it, and it brings result. When something goes wrong in Moosonee and Winnebago, you were on the phone and basically you got to the bottom of it and make sure that the people of that end of the province had the critical transportations they needed, especially at the time where the ice was breaking up between the island and the mainland. So things have changed for the good of the people of Ontario. But here again, I come to what are the most important features of oversight, given that we know we don't have units like you guys for every part of the healthcare system, some of them spending hundreds of millions of dollars, not unlike Ornge. And we don't have a dedicated unit like you guys. What are the important features of oversight that needs to be there that you guys are bringing?
So I would talk to I think a few elements that are important to oversight. First is defining what it is that we're actually expecting the service provider, whoever that service provider is. What is it that we are expecting them to do for the investment that we are making? What are the controls that that organization has in place to monitor itself? And what is the role that the respective board governance is at that particular organization? I think you need to have an understanding of the results that they are delivering in terms of outputs and outcomes. I think you need to have an understanding of what their financial situation is and what they're using their funding for. I think there are lessons to learn from the work that we are doing, and it is a work in progress. We've been at this for a few months since, I came on board at the end of July, and there was Stephen and myself and another individual. But I think as I said, I think there's lessons that can be learned and can be shared with this. But ultimately, I don't think every organization that the Government of Ontario funds needs this level of attention.
I agree.
And it's being able to identify which areas of where you might need that attention and dedicating that resources. We don't have, we have a finite amount of resources to do, and we need to direct those to where we think there's the highest risk.
I have a question for you. In terms of oversight, how do you measure good oversight? So we have different institutions and different mechanisms in place to provide that oversight. How do you actually assess if you are, you or any other group or any other mechanism for oversight, how do you measure if that's good oversight or not? What are your levels of, I guess, what is your performance measures to ensure that you're doing a good job of even providing that oversight?
I would think the ultimate performance measure would be in terms of the specific objectives that are assigned to that particular organization you're funding. Are they delivering upon those objectives? And if you're doing an oversight role, if you're doing a good oversight role, I think you can understand what's going on. But ultimately, I would say my role as looking over oversight at Ornge, it's not to run the air ambulance program. It's to ensure that the people that are running the air ambulance program are running that properly. That's, I think, their operational responsibility and operational accountability. I think I have a system accountability to ensure that those systems are in place and that those are happening.
So one measure would be whether or not the body or the organization that's being that's under oversight, if it's achieving its results or its performance measures, that's one way of saying that the oversight must be good. Are there any other independent ways of measuring if the oversight is sufficient and if it's exhaustive that you can give us in terms of a way for us to measure if the mechanisms we have in place are sufficient? How do we measure and say that this is a sufficient form of oversight, or that this team or any team is doing their job effectively to provide that oversight?
Other than saying that that's a very good question, I don't really have a particular, I don't have an answer to that. It is, I mean, if I thought about it, maybe I could come up with an answer, but I don't. But I mean, it's a really valid point.
Thank you. I'm sure my colleague has a couple more questions.
Along the same line then, let's say, you know, like you celebrate your second, third anniversary, you now get a pretty good grip as to what makes for good oversight. Are there mechanisms within your unit or your department to share those lessons within the ministry? Do you have an opportunity to do this?
I think that the opportunities could certainly present themselves to do that and share that information. Our focus has been in actually doing the work, not going out and
teaching best practice.
Tooting our successes, because there's still much work to be done here. But there are certainly forums across government. One that comes to mind is the Policy Innovation Leadership, and it's a cross-ministry group where you can find yourself there to come and present and learn and share best practices across the OPS. Is one that comes to mind immediately.
Okay, so on a different train of thought, so let's say you go back to your office this afternoon, you have a phone call for somebody who tells you she's just been made aware that somebody at Ornge is receiving twice his salary. He's receiving it under two different names. I'm making that up, by the way.
Okay.
What would you do with that information?
My immediate response to that, and I know it's a hypothetical example, but it's a serious hypothetical, if that was to occur. I would be immediately in contact with Dr. McCallum, asking him what is going on. Please explain what is going on. I need to go, you need to provide me with documentation and information with respect to what is going on and how has that occurred. And I would go right to the top and deal with the CEO.
And we're out of time for this round, so we'll move to the government. Ms. Jazik.
I'll start, Chair, and I know my colleague has a couple of questions as well. I'd like to go back to the reports you sent us, mainly because I spent a few hours going cross-eyed over them. Ms. Deol, perhaps I could go back to the investigations and complaints report that you've been working closely with Ornge and the health services branch, the emergency health services branch as well, as I understand it. How are you working to ensure that we have more closed files in terms of these investigations and complaints? Like, I was fairly struck by the relatively high number that seemed to have accumulated over time. So could you just talk to us a little bit about how, in your role as overseer, you're kind of pushing for the conclusion to these reports?
So number one, just to clarify that report, where it indicates from for the Ornge investigations, there's on the report that you're seeing here currently, there's definitional errors. So what they've been doing is they've been documenting every incident they have and counting that as an investigation. So number one, that's why we've engaged the audit team to review even what their definitions are and what they're reporting. Number one. In regards to the ministry investigations, sorry, I might be too close. Every week, effective January, since I've taken on this portfolio, the first thing was just to look at, why are these files, number one, open, and why have they been open so long? And number one was to improve communications and build that, and to have a forum to discuss these investigations and make them a priority. So we have weekly meetings, which include Ornge senior management. So we have the vice president, the director of professional standards and compliance, the lead for investigations at Ornge, who also started with that portfolio around the same time I did. We also have an investigations coordinator at that meeting. We have I attend, and then also with the emergency health services branch, we have the manager of policy and implementation on those lines. So the first thing we do is we review each one of the findings or the reports and outline any outstanding issues.
Now, so are you optimistic over time with this sort of intensity and urgency that you're communicating that we will start to see, do you have a goal in terms of resolution?
The goal is to have no investigations open and to ensure they're done within the recommended timelines, and some of that has to do with also trending. So what we've been doing is looking at certain investigations. So for example, currently there's 4 investigations open relating to a policy. I can name the policy, and so what we've done is forwarded that to Ornge that they need to amend that policy, and that was found in the findings and the recommendations from the investigators that you need to review this finding and make sure staff are trained on this finding. So that policy has been revised. We received it back. It was forwarded to our investigations unit to review again, and is then and then now has been sent back to Ornge. So that will address those issues to see when it comes back to ensure that that policy takes into consideration number one, the investigations, and that could be closed. We're also establishing further meetings for other issues, not issues, but other investigations for trending. For example, Ornge has reviewed their triaging policy. So we're meeting with Ornge senior management in June to review a number of files that revolved around that recommendation or considerations regarding to that finding. So what we're doing is meeting, it's not just meeting, but ensuring that we're also coming to conclusions and finding it could be policy-related incidents as well, and ensuring that we have new policies updated as well.
Okay, thank you. So, yes, Mr. Jackson.
If I would just add something to Meena's answer. One of the things that I think we're seeing with the instances and investigations that we're doing was the communications that would happen between the Ornge Control Center, the sending hospital, and the receiving hospital about explaining what is happening where. Like, where is the resource? When is it going to arrive? So part of it, the strategy that Ornge has put in place, is that they had a generalist model where everybody in their dispatch center, they were call takers, they were medical they were flight trackers, they looked after the Provincial Transportation and Authorization Center. Now they've provided specific training and certification in each of those areas, so that the people have a specialty that they attend to, and not a generalist approach that had been introduced by the previous leadership at Ornge. So there's systemic things, I think, that can be done with the service delivery that's actually going to reduce the number of investigations, and then we won't have as many to close.
So my follow-up really relates to the quality improvement plan. We know we saw the first one last year. I understand Ornge has submitted a second one. Will you be including these sorts of goals, just as articulated in terms of the resolution of complaints and so on, within, will there be that kind of specificity in the next iteration of the quality improvement plan? I mean, I would like to be able to look a year from now and see that this kind of improvement has occurred. So how does this tie back into the expectation over the coming year?
I think it's also important to note in regards to the investigations, a number of these investigations that are currently open occurred for incidents in 2012 or prior. I think when, with the implementation of some of the, for example, like as Richard was noting, the changes with the OECC, with their Ornge Control Center, that we anticipate that moving forward we would see less investigations because there has been changes to the structure or the way some of the larger issues. So, for example, the changes to the model of the OCC, the fact that they're doing call taking and auditing of their communication officers, and other steps they're taking in regards to improvements to the actual communication control center, which are outlined in their QIP. So moving forward, we would expect to see less investigations.
And they are outlined in the QIP.
I would say that, and it's always great to get advice from people around this table. In the specific metrics that have been approved by the board for 13-14, there's not one that specifically speaks to the resolution of findings in a specific time frame. The fact that it's not in the QIP, certainly taking the advice away today that we will be pursuing with that with Ornge, because if we're going to measure it, there better be a target that we're measuring it against, and we don't have that at this point.
I would suggest that would be useful. In other words, it is a toing and froing between Ornge and your branch in terms of developing and monitoring those metrics, and thank you for acknowledging that. As I looked at the requests versus transports, maybe I'm being overly optimistic. This was the next series of data that we got. It seemed to me that the gap was narrowing somewhat in terms of requests vis-à-vis actual transports. Am I being overly optimistic, or could you talk to us a little bit about this series of data?
This very long series of data, and
I found the graphs the most useful at the end.
Okay, we're at the graphs. I find one thing I will say with the graphs that are contained in this report, the scale that they're at, I find it difficult to identify how small that gap is going. In terms of the number of requests for transport, I think it's useful to actually look at some year-to-date summaries, which if I find, I don't think there's been, I wouldn't say a statistically significant improvement in the number of requests versus the number of transports. Ornge tends to actually respond to, Ornge themselves responds to, it is around 70%. The other 30%, there are reasons for why those are not being responded to. And some of them, in a sense, make, to me at least, make sense that it's an on-scene call. The land team has arrived. They've called for Ornge. They realize that they can get to the tertiary hospital quicker than it will take to actually deploy the helicopter, get it there.
So what is your advice then, because obviously now you've got a duplication potentially of resource, how are you handling that issue?
That is something that I think is an important part of Ornge's operational objectives for 13-14 and for subsequent years, is to, the terminology they would use is to have a clearly defined mission profile. To put it as a specific example. If there is a car accident at the interchange between the 427 and the Gardner Expressway, and there's a land team that's on there, does an Ornge helicopter need to be deployed when they're already on the route to Sunnybrook or St. Mike's? But there needs to be a clear understanding of all the stakeholders that are involved in this. And it gives me, I'm more than optimistic that the thought processes that are going on right now at Ornge between Dr. McCallum and his senior management team and his operational managers and the linkages that they are building with local EMSs, with hospitals and LHINs across this province, where I would say 18 months ago, 2 years ago, Ornge was acting in this isolated, we are Ornge and this is what we do, and we don't reach out, because I think we need to think about this from a system perspective.
We certainly got that impression, at least the government side, when we visited Ornge. Dr. McCallum was talking about everything's on the table, which actually leads me to recommendation 2 of the Auditor General's report of 2012. Maybe Mr. Haddad would like to outline a little bit for us. Deloitte, I understand, is studying the issue of critical land ambulance vis-a-vis air transport. Could you give us the terms of reference, perhaps, of what Deloitte is looking at, and then tell us a little bit about the pilot that's going on in Ottawa?
Certainly. So I would refer you to the Auditor General's report and recommendation number 2, because to be honest, it very clearly outlines exactly what it is we're trying to accomplish with this program review. So from the very first point, which is assessing current total demand for critical care land ambulance transports in Ontario, part of the first level review that we had asked Deloitte to do was sort of an operational look at how many transports are actually being conducted compared to how many perhaps the program had expected several years ago when it was first created. Taking a look at also what opportunities there might be if the service were expanded. So for example, it's currently offered in 3 bases in Ontario, plus Toronto EMS provides receives funding through Ornge to deliver the service in the GTA, and to see if there might be a demand in other regions of the province for that type of service. As part of the review that they're also doing is meeting with stakeholders from different sectors of the different parts of the healthcare sector to look at potentially capacity for other service delivery models. I think at this point it would be premature to comment on what the findings or conclusions might be of the report, because the work is still going on. But we have certainly, I think, that they have received a broad range of input into their work, both in terms of operational and financial data from Ornge and other stakeholders, to be able to allow them to have a very clear picture of how the program is being run and what niche market it's serving. So effectively, as I refer back to the Auditor General's observation.
And when do you expect that report to be finished?
I believe sometime next month we should be receiving a report from them.
And a little bit about the Ottawa pilot.
Certainly. So one of the things I believe Mr. Jackson earlier mentioned in his opening remarks is ensuring that the right resource is being used at the right time based on the acuity of the individual patient. So the example he gave, if there was a land vehicle that was perhaps closer to be able to respond to a patient, and that would be appropriate, that perhaps the dispatch of an air, which could in fact take longer because of the time to ensure that, do a weather check, go through the full process, that perhaps it did make sense to make use of a land resource and just staff it appropriately with a critical care level of paramedic. So in the Ottawa area, a pilot that they had looked at was, were there opportunities to defer some of these air calls or transports that were being serviced with an aircraft to service it with a critical care land ambulance, or with one of the additional ambulance resources that they have. And my understanding, though unfortunately I don't have specific details for you today, is that so far it has produced positive results in decreasing the reliance on air, and ergo has resulted in some cost savings.
Okay, thank you very much.
Thank you, Mr. Jackson, for coming again. And I really want to compliment all of you and your team. In the short time I've had to evaluate you, all I can say is you present yourself very well, very articulate, and most importantly, you've certainly demonstrated a good command over your briefs. So congratulations on that. I'd like to just begin by trying to get an overall picture. You've been on this job, this particular piece, and your team for about 8-9 months now. So it's a relatively short period of time. I think of it like a garden. You first weed it and you sow the seeds. It takes a while to actually see the results, but that doesn't mean hard work hasn't gone in. So I'm just trying to understand, in the short time you've had, could you just give me 1 or 2 illustrations of what you think are your team's main achievements?
I would say, when I think of the team's first achievement, is that we've actually been able to get, for the first time, a clear understanding of the services that Ornge provides, how they provide them, and the plans they have for improving those services. So just it was a greenfield that we inherited. Here's a performance agreement, figure out how to implement it. So I think that was, I would say, just being able to pull this information together and start the work of analyzing it. I'd also think what is something that I'm proud of is the work that we have done in having a much better and detailed understanding of what Ornge actually spends its money on. And we now have that from a budget perspective, and we will be tracking that from an actual perspective, so that we can actually, if we're paying Ornge to do organ transplants, it would be useful if we actually knew how much, and we do know what that costs. The other thing that I would say that I am proud of is the professional working relationship that we have developed with the senior people at Ornge. We are not running that organization. We are not there to be their friends. We're there to be their overseers. But we have, with our stakeholder relation skills that we all bring to this table, been able to engage their management on a regular basis on important discussions that need to take place. And I think that is critical to our success moving forward, is knowing that you can pick up the phone, get the information, and it doesn't matter when, where, or where that's going. So
okay.
That's
actually very useful for you to have summarized it that way. How much time do I have?
You have just a minute left.
Oh, just a minute left. So my next question is just around the performance agreement that you mentioned. And I just wanted to know, what tools does this new performance agreement give you that perhaps the old one didn't as an overseer? Could you just elaborate on that? Tools to oversee.
In terms of tools, the fact that, if I was to, I'll give a few examples. The fact that there's a requirement that there's a ministry representative actually sitting on a board subcommittee on an issue as important as the quality of patient care. I think the other tool, one of other tools, is my understanding under the old performance agreement, there was only a limited number of times when the ministry could actually show up at Ornge and do the work that they needed to do. We can go and be there whenever we need to be and whenever we want to be. And I think that the other critically important tool is the amount of information that Ornge is required not just to provide to us, but provide transparently to the public, so that, accountability is not just to the ministry. There's an accountability to the public, and I think I see that in the performance agreement, as a result of the performance agreement.
Thank you very much. We'll move on to the opposition. Mr. Klees.
Thank you. I would like to pick up, Ms. Deol, where we left off in terms of this report. What I don't see anywhere in the definitions of these complaints or incidents is a reference to a significant patient adverse event. Do you know what I mean by that?
Yes. Well,
Why is there no reference to that category of complaint or event?
in this chart, all incidents, according to as defined over the ambulance document standards, are included. So any incident that applies to that standard are included in this.
And so where do we go? Because I'm assuming you'll agree with me that it's the significant patient adverse event that really we're interested in primarily. How do you, as an oversight body, get alerted to how many of those events are occurring in any given month?
Every day we get a copy. Every day we see each event, each incident is reported to us according to these standards.
Hear me. There's a difference between not having gas in the tank or not having enough bandages or having a short to what is defined as a significant patient adverse event. Those are the critical issues. How do you, as an oversight body, get alerted to those?
We have a quality of care committee that our director sits on, and some of these can be addressed through him.
No. My question is, even the quality care committee, how do they know what to look at? Is there no trigger that comes through this reporting mechanism for that kind of event?
Every event is important.
I'm sorry.
Every incident that's noted here would be considered a priority or important.
That's not good enough. One of the findings of the Auditor General in his report was that Ornge, this is the old Ornge, right, under the old system. Ornge internally reported 20 significant patient adverse events in 09-10. Its board of directors, including some that involved patient deaths. These are significant events. The Auditor General, in his report, flagged this as a real concern that these particular cases were not being properly reported. And what I'm interested in is, under your system and under your oversight, are those particular significant events identified? How are they? Surely, out of a basket of 40 incidents or complaints, somehow you must have a mechanism to identify 3 or 4 of these significant adverse patient events.
Each one of these events, incidents, or every incident is, like I said, we receive these reports daily.
I'm sorry. I can't accept that.
I'd like to...
Please, could I assist you with the question that you're asking, because it's a critically important question. So in these reports, and they're referred to as care reports that we receive, they outline in quite significant detail what the actual incident was. And where are incidents that certainly when we would see a situation where there was a death, or certainly in situations where vital signs were absent, those would be the ones that we would identify in consultation with the investigative arm of the Emergency Health Services branch, and we would initiate an investigation. We look at each of those reports that we get. They outline in this section, and it's admittedly in very small print, in the left-hand column, of the type of things that need to be reported. Is there an unusual response or service delay? Is there a delay in accessing the patient? Is there an excessive amount of time on scene? And when we see those are the ones that are serious. Those are what drive ministry investigations.
There's nothing in here that triggers a patient death indication, this is my concern. The reason I'm asking this question, Mr. Jackson, is because I have here a memo, a Ministry of Health and Long-Term Care memo dated May 23rd, 12. It's confidential for cabinet purposes. I'm going to read you what it says. The headline is, the heading on it, issue, status of investigations related to air ambulance and related services at Ornge. It reads as follows, and I'm quoting, "The amended PA no longer contains a requirement to report significant adverse events. Instead, Ornge is now required to report to the Ministry of Health and Long-Term Care any incident that meets the requirements for reporting under the Ministry's ambulance service documentation standards." It goes on to say that it essentially is left up to Ornge to make the determination in terms of what is significant and what should be reported. My concern and my question then to you is, are you aware of this memo? Are you aware that the reporting requirements have actually changed? And if you are you concerned about that? I certainly would be if I was in a position of oversight, because if in fact it's being left to Ornge staff to make the determination about what is significant to report, we're right back to first base on this thing. So I'd like your response on that. Are you aware of this memo? Are you aware of the concern? This is a Ministry of Health document. And if so, what is your response to it?
The specific memo that you're referring to, Mr. Klees, I don't have in front of me, so it's difficult for me to comment on this. But we are asking Ornge to report on all incidents, not just those that are serious incidents. There are other processes within the medical oversight role that goes on through Ornge's Medical Advisory Committee, where they have a process in place where they are doing chart audits of I believe it is 20% of the actual medical transports, where Ornge's medical directors are reviewing those charts to determine whether or not there was an issue with the level of care that was provided by their paramedics. Those reports and that summary information is provided to the Quality of Care Committee for their review and for the board's action.
Okay, can I ask which of the staff can give me a definition of the patient of care standard for air ambulance?
It's the
patient care standards as defined in the Air Ambulance Act. Does anybody know it offhand? Should be pretty basic.
Meena, would you like to? Speak to that?
Do you want to go for that?
So I'm assuming you're referring to a document that's produced by the Emergency Health Services Branch in collaboration with their Medical Advisory Committee, which is called Ambulance Service Patient Care and Transportation Standards. The last version I have is October 2007.
Okay. Can you tell me what that standard of patient care is for air ambulance?
I can describe it in general terms, yes. I'm just wondering if other members of the committee would benefit from having a copy?
Well, we don't have to. I have to leave early, actually. I've got about... I was hoping that as staff being responsible for oversight of air ambulance that you would know. I'll share it with you. And I'll read it. Pretty fundamental. There must be 2 paramedics trained at the highest level of care, critical care, in order to provide critical patient care on the air ambulance. That's fundamental. With that reminder, have you heard that before?
It's highlighted in my document.
Good. So let me ask you this, and I think it's Mr. Hoque who's responsible for resource availability reports. Can you tell me, based on that standard of care, whether or not Ornge Air Ambulance is able to meet that standard of care? And if it's not, what percentage of the time is it not able to meet that standard of care?
Sure, I'll be happy to answer that for you. When we're talking about meeting the target level of care, we're talking, as you said, having 2 or more paramedics at the right level of care as defined by the base. We know that in Q3, they reached that 66.4% of the time, and by the end of Q4, they reached that 70.3% of the time. We know that they've had 2 or more paramedics on duty in Q4 96% of the time, and that the amount of times that they had 1 or 0 staff have also improved from Q3. And based on the staffing work that the branch is doing and Ornge is doing, we're looking to reduce that again and again.
Okay, so let me simplify this, because I want to get it down to the current level of care. So last month, what percent of the time was Ornge able to meet the standard of care, where they had at least 2 paramedics, one of which was trained to the critical care level?
Based on the reports you have, if we're talking about last month, I'll speak to the report that you have with the last month being March, which would be 68.4% of the time.
So in March, only
68.4%
of the time were we staffed to the standard of care. Now, my understanding is that prior to Ornge taking over the full operation, that there was actually a mechanism within the agreement with the service provider that if they weren't able to meet the standard of care, that there were penalty clauses in those contracts. Are you aware of that? And there were financial penalties to that provider. Are you aware of that?
Yes.
Yeah, Hansard doesn't pick up notes.
Yeah, I know. Yes.
And can you tell me what penalties or consequences have there been to Ornge for not meeting those standards of care?
There has not been a penalty or consequence to Ornge not meeting that standard of care.
From the standpoint of oversight, oversight is one thing. Enforcing a non-compliance is yet something else. Would you agree with that?
I would agree with that.
I would think that in order to make your work meaningful, that if you find Ornge not to be in compliance with your oversight, then there should be some consequence to Ornge. Would you not agree?
In terms of a consequence, so under the current contract, the previous contract, there was a financial penalty to that. In terms of if there was let's say there was a financial penalty for not meeting that level of care, we would be removing funding from Ornge. The majority of their costs are fixed. Their costs are fixed in terms of their staff, their aircraft. There's not a large variable component to their budget. Fuel, medical supplies, perhaps. If there was a penalty, and there could be a penalty, the impact of that penalty would be potentially a further reduction in service.
Well, you make my point. The very fact that this is an internal game, that there cannot be any financial consequences or any consequences of any significance to Ornge for not complying, means that while we may have a structure of oversight, the fact that there's no consequence, we really have no mechanism to bring these people into compliance, which is one of the reasons that I think this committee is very interested in reassessing the structure that we have. Based on information that we have in this committee, the compliance for standards of care under the previous system, where we had an external provider, was some 98% on a very consistent basis. Now, I'm not so much concerned about financial penalty to anyone, because what we're really concerned about here is patient care. And when an organization is motivated to provide patient care at the optimum level, then that's really what this is all about. And that's what we want to achieve. So I wish I had more time to pursue this, but unfortunately I have to be on my way. Thank you for being here.
Welcome, sir.
Mr. Barrett?
Thank you, Chair. Just a question, I'll continue some questions to Mr. Jackson. And as director of an air ambulance program oversight branch, I think my question is, a department or a branch like this, is it seen as a time-limited department? And I should, in fact, maybe fill me in, when was this set up? And secondly, how long do you foresee this branch existing in its present form?
It was established in July of 2012. It is a permanent branch. The positions are permanent FTEs, part of the Ministry of Health and Long-Term Care's FTE complement. There is no sunshine period on when the work of this branch will cease.
Okay. And we have a branch, I think it's 6 staff altogether, as I recall. And within either this ministry or perhaps education or agriculture, are there other branches like this focusing on oversight and accountability? Comparables? Are there?
In terms of my own experience, Mr. Barrett, within the OPS, the only comparable one that I could identify would be the private career college branch in the Ministry of Training Colleges and Universities, in the role of the superintendent and his or her staff, with a specific focus on that one sector. There may be others.
Sure.
I don't know.
Not that I recall any uproar with respect to career colleges. There was no special reason to have that within that line of work, was there?
There had been historically a very small, and I know this from having worked there.
Yeah.
There had been a private career college oversight was done by a superintendent and 2 investigators that split the province east and west from Yonge Street, and they apparently were responsible for looking after that. There had been a series of instances of, I would say, serious administrative irregularities bordering on fraud, if not fraud, across private career colleges. Many students being left on the street.
Oh, yes, okay.
Okay.
I remember that now, yeah.
And that branch has grown exponentially in response to the risk that proposed.
So maybe there were some special reasons, as with the Ornge situation. And I see the mandate obviously as oversight, accountability, control, but I also see that as one of several functions normally of management. Certainly at the CEO level or a chief operating officer level of senior management, I personally see that as one function, along with planning and organizing and providing leadership. I see that a function of really anybody that's being paid to be a manager. By having this special unit, and if this is a model perhaps for other ministries or other government funded bodies, does that take the onus off a manager somehow, that, well, this is being done over here? Has it changed, or can you see it changing the role of management within the Ontario Public Service? Maybe you disagree. I feel control is part of management.
In terms of management, when you're speaking of management, Mr. Barrett, is it management actually at the organization itself that's providing the service on behalf of the using provincial?
I think I'm referring to any government department or ministry that has line managers.
Okay.
Obviously senior level managers even to the level of a supervisor. To my mind, if someone is being paid as a supervisor, even a coordinator, it involves planning and some organization, perhaps maybe not strategic planning. But I guess my question is, even at a, I shouldn't say lower level, but at a supervisory level, is not accountability and oversight and control, keeping an eye on, you know, even how many paper clips were bought that week, isn't that not part of their job?
I agree with you 100% that transfer payment accountability is a responsibility of any public servant that has that role. In the transfer payment accountability directive that we base our work and is certainly used across the OPS articulates specifically the responsibilities of every person in the organization when it comes to accountability. I think what's happened here with Ornge is that organization got so far off track that there needed to be dedicated resources paying attention to what was going on that because of the critical services that it provides and how badly they lost their way.
And you are out of time, Mr. Barrett, so, and there's a bit of time left, so if you'd like to use it then, okay, we'll move to the NDP, and you have a few minutes. Who would like to go over there? Sure. Mr. Singh?
I probably won't use my full time. I'll just ask a couple of quick questions. Just want to touch on an issue that came up today where we spoke with, just to give you a frame of reference, we spoke with one of the directors that was dismissed, and there's an article about her being dismissed as well as one of her colleagues, and the issues that came up was that both these members of the board had asked a number of questions and were seen as unwanted, or because their questions were maybe too probing. Dr. Maz at the time did not feel that they were appropriate to be on the board, and so encouraged them to essentially ostensibly fired them, but in another way. It got the committee thinking about the importance of a proper governance to ensure that organizations are they have oversight internally as well as externally from the ministry. And in order to have, I guess, a wholesome picture of oversight, if we have boards that have members who are dedicated to overseeing their organization internally as well as the ministry or an external oversight, that would be the most robust form. What guidelines would you recommend, clear guidelines, for one of the suggestions is having a non-voting member from the ministry be able to sit in board meetings, and I know that you're already doing that. But what other guidelines would you recommend to ensure good governance in a board of directors, perhaps outlining, what mechanism or what method to select these members, board members, and any other criteria you can think of that would establish a good board as a starting point for internal oversight?
I think a critical point, a critical part of any board's role is, I would say, the ability to do their own self-evaluation in terms of you reflect upon the work that you're doing as a board and the governance structures that you have in place and look at ways to continually improve them. I think another tool and mechanism that is useful to have in place is a framework in which to evaluate the capacity of boards. It's a tremendous amount of responsibility placed on boards, and I know from the work that I have previously done at the Ministry of Community and Social Services and the Ministry of Children and Youth Services, one of the pieces of advice that was provided by the Auditor General at that point, because our response would be, that's the board's responsibility. Well, how do you know that the board is carrying out their responsibility? So those two ministries developed a board self-assessment tool that was used. The program staff that were responsible for oversight would review that and identify if there were weaknesses in board governance structure and then if those were there, would approach the board and say, what processes are you putting in place to address those particular issues?
Okay, and we'll move on to the government then. Who with the government, Ms. Damerla?
Thank you. Mr. Jackson, I just wanted to continue with the line of questioning we were going with around the performance agreement. And I just wanted to know, at this point, do you feel that this particular performance agreement gives you all the tools you need to protect the taxpayer?
In terms of the performance agreement, I think it amongst itself provides a wide range of tools. When I look at the role of oversight or regulation, I will specifically note the legislation that's presently before the General Governance Committee, Bill 11. In terms of, I think to have the full toolkit of oversight and regulatory responsibilities, the ability for the Lieutenant Governor and Council to appoint a supervisor when an organization is off track. And when that organization is of such critical importance, it's not like you can just pull the plug and say, well, okay, we won't have an air ambulance program tomorrow. But we do need, I think, the ability, and it's not be used in any wanton fashion, but when if that unique set of circumstances applies where you actually have that ability. So that would be one of the things that how I'd respond to you.
And that would come through Bill 11, and that's what you're suggesting, right? So
right. The current performance agreement doesn't allow us to appoint a supervisor.
But if we could get Bill 11 through and enacted, then that would give you those rights to supervise if required.
That would give the ministry and the government the authority to do that, yes.
So what you're really saying, it's a package deal, so it's good we have the performance agreement, but we really need to beef it up with the help of Bill 11.
I think I would suggest that backstop be available.
Excellent. So, that was going to be my next question, but you've answered the value of Bill 11, and I really appreciate that. I don't have any more questions, but if my colleagues have any?
If we have just 1 minute. As you're probably aware, Bill 11 is modeled on the Public Hospitals Act. Do you see a parallel between protection of patient safety in a hospital to air ambulance, as you've come to know it?
I think there are very strong similarities between the public hospital system and what is actually going on in an air ambulance. We are transporting people from one hospital. Ornge is transporting someone from one hospital to another hospital, providing a high level of care that's provided. It seems like it's literally a mobile hospital moving from place to place.
Thank you very much.
Thank you. And Mr. Barrett, do you have one further question?
Well, maybe one quick one. Just maybe going back to the manager-supervisor analogy. Through your department, you have mechanisms for compliance at the supervisory or management level beyond, say, job performance reviews. Do we have an appropriate compliance structure in place to ensure that oversight, if it is a function of management, to ensure that is being accomplished? I just asked that in general.
Yeah, and I'd answer it in general with, I think that process is in place. It's just been brought home from, I was doing this recently in the past few weeks, is there's a process within the OPS called the Certificate of Assurance process, where there are
Certificate of Assurance?
Certificate of Assurance process, which outlines in quite a level of detail the various checks and balances and controls that you need to have in place, and you need to be able to attest that you've actually have those mechanisms in place. So I think that tool and that mechanism does exist.
Very good.
Okay,
and thank you, Mr. Jackson and all your team for coming in and helping with the work of the committee today. It's appreciated.
very much appreciate it, and I appreciate the advice that we got from many committee members today in assisting us in doing our work going forward. Much appreciated.
Thank you. And just for committee members, just to advise that next week we will be using our time doing report writing. And also, if committee members could let our clerk know about this CCPAC meeting, that would be appreciated as well. Otherwise, we are recessed. Oh, no, we're adjourned. We're adjourned.
This is the Ontario Parliament Television Network.
Coming to 4. 4. Coming to 2.